exciting news about a new procedure offering hope for people suffering from heart valve disease. And now, what is that, first of all?
Well, there's a number of things that cause diseases in heart valves of the human heart. There's 4 different valves, but the valve we are considering today is called the aortic valve. Aortic stenosis, which means tightening of the valve, which prevents it from opening properly, which prevents blood from getting to the brain and the rest of the body. It's a condition that affects over 1 million people in the U.S. today, and there's a number of individuals who develop this condition late in life, so they're usually high risk or either inoperable for surgery, so they really don't have many options until now.
Okay, so you're talking about people who are over 70?
70, 80, 90, individuals who basically have other conditions too. If you have COPD or other conditions that would make you a high-risk surgical candidate, this is a type of disease process, aortic stenosis, that cannot be cured with medications.
So here it is. This is kind of intimidating looking. What do you do with this?
Well, this is actually the valve itself. So the main thing is, first, before we introduce this, we use a catheter to be placed in the femoral artery of the groin. This catheter through a sheath, and after that's done, this valve itself is deployed on this catheter all the way through the sheath into the heart itself, and the valves themselves are right here. And this is actually this is initially crimped on the balloon.
Okay, hold that really steady so we can take a look at that. And that is going to take the place of a valve that's collapsed?
That's already in the heart. So the valve, that's the aortic valve, which is already present in the heart, this is placed inside of it and deployed. And the old valve is basically pushed against the walls, and this new valve is now functional.
It looks to me a bit like a stent.
It is exactly that. It's called a stent graft valve, basically. The stent is around it, and inside that tissue, that yellow tissue, is actually a pig valve, a porcine valve, which we put in the open surgical valves.
So open heart surgery be gone, going in through the groin.
Well, the thing is that, I want to make sure our surgical colleagues watching here that we're fully, we acknowledge that open heart surgery is very good for certain patients. This, we believe, for patients that cannot get the surgery or high risk for surgery, this is a great option.
Is it widely available at this point?
It is becoming more widely available every month. The Edwards Life Science Company is the only FDA-approved valve currently on the market, and we anticipate in the next 5 years that this is going to be a growing technology.
Now, can anybody, personally, I would opt for this even at my age now if I needed it. Can I? Or?
Well, the thing is, the government has currently stated the guidelines that only high-risk or inoperable patients can get this valve.
So in other words, insurance won't pay for it unless you're high risk.
True, and you need to have an evaluation not by someone who is just an internist or a cardiologist. You need a surgeon, a cardiologist, basically a full disciplinary team to evaluate you prior to getting it.
Might it open up more to others who are afraid of the open heart surgery?
Eventually, I do believe that once we see the results of these trials or results of the initial patients getting these valves, definitely, I think it's going to open up within the next 5 to 10 years.
Okay, and just really quickly, symptoms: severe shortness of breath, gasping, chest pain, tightness, extreme fatigue, lightheadedness?
Well, the symptoms of aortic are severe shortness of breath, chest pain or tightness, extreme fatigue, feeling lightheaded, difficulty exercising. Again, these are the symptoms of aortic stenosis that TAVR can treat. Okay, wonderful news. All right. Thank you, Dr. Iyengar. That's exciting.
And if you want to learn more, you can find the Dear Doc on Facebook or just go to our website, daytimeonline.tv.
We'll be right back.